I'm Kerry Keffaber. I'm a veterinarian that works for Elanco. Elanco is an animal health company. It's a division of Lilly. And we're engaged and involved with a lot of discussions about overall sustainability as a company, but also primarily working with our customers and trying to have safe management tools to increase productivity. But today I'm going to talk and go deeper in one specific area that Nicole kind of touched on as well, and that is antimicrobial stewardship. And I think as we look at this, antibiotic resistance and lack of effective tools to treat infections in animals or humans is a significant concern. And the science is helping us sort out the relative significance of animal use, human use, different types of uses, and we'll learn a lot from that. But as we have that debate and have that discussion, I think it's also clear that we know the animal impact is not zero. And we also know that animals will need antibiotics for their health and welfare, food safety, and overall sustainability. And as we've looked at this and trying to come up with solutions, how do you get the and statement? How can we maintain long-term effectiveness of antibiotics and meet the need for use in animals? Can we find a path forward that has the minimal unintended consequences? So as we look at this path, sometimes the steps we make could both have an impact on some of those points that's important to use them in animals, but also impact negatively the outcome of resistance that we're concerned of. So we've focused, along with many of others and organizations, to look at antimicrobial stewardship, and we've looked at under the umbrella of One Health. And what we seem to understand and reconfirm that the health of animals, the health of people, and the health of the planet, are all intertwined. We must optimize all three and not look to maximize one. And they're all tied together. And part of this discussion has led to, we had a help sponsor a summit and put together the people that are bright and smart to talking or continue the discussion about how do we move forward on this path room. So, for this group here at this meeting, this is not a surprise or new. Lots of others it would be, but 1 in 3 people in the world get the wrong nutrition. Sometimes that can be inadequate, but in many parts of the world, it's the wrong nutrition. That we're focused on calories versus density of diets with protein, amino acid, and micronutrients. So those health challenges that are driven by nutrition impacts the health of people. We're part, Elanco, of Lilly, which really sees us fitting into the overall human health because nutrition is a foundation for human health. Nutrition is critically important if all the medicines they produce work in people. And when we look at a lot of those diseases, the chronic diseases, if we could improve nutrition, we would have healthier people and healthier overall medical outcome. Again, as repeated this morning, 60% increase in demand of protein globally in a growing population. We have to balance that. And as we've looked at it, OIE's data is 20% of animals are lost by death and disease. It's kind of the waste that maybe we don't recognize and talk about as much. So how can we protect that loss and provide nutrients to the human population? And the last, the healthy planet. So 1.6 planets we're using now to produce the food that we consume in a year. Again, no secret or surprise to the people here. But all those fit together. So if we can lead to a healthy animal, leads to healthy people, and an overall healthy environment. So we updated our antibiotic policy in 2012. And then in June of 2015, at the White House Summit on Antibiotic Stewardship, we launched our 8-point plan for antibiotic stewardship. Now, the 8 points had certain emphasis that we thought was critically important for us to work with our partners to move forward on, but it revolved about responsible use and innovation. So when we talk about responsible use, one, this is a global situation. So we looked to global partners both geographically, but global partners in different, from NGOs, food producers, farmers, manufacturers, to try to move forward policies and processes that encourage responsible use globally. We ceased marketing of growth promotion for shared class antibiotics. It makes common sense and practicality. We should reserve those shared class antibiotics for therapy only. We've looked at trying to eliminate the need for continuous use antibiotics and looking at alternatives to lessen that need for all use of antibiotics, but specifically those situations where they may be used for extended period of time. And we're looking to move all medically important antibiotics to oversight by a veterinarian. We feel they're the ones in the best position to make that medical decision, protect the healthy animals, and make sure we use them responsibly. In certain geographies, concurrent antibiotics are given at the same time for the same disease condition. So we're working to eliminate that. And then, if we're going to put veterinarians in charge, how do we develop the capacity, but all the capability and the structure to function globally? As far as innovation, really evolved around two things. Animal-only antibiotics, those antibiotics, and there's not a lot in those classes. It's not just individual antibiotics, it's that entire class that are only used in animals, such as ionophores. By using those, we could reduce the use of shared class antibiotics and have no impact on resistance of human concern. And the last is look at new innovation to decrease the need. We committed 70% of a research budget focused on those disease conditions that are driving the most use of shared class antibiotics. So, when we made this statement in June of 2015, we said, if you don't put a time and a date and response, what does it mean? So we committed to come back in a year and report on progress. Again, we've reached out to over 10,000 producers globally and vets to improve responsible use policies. Globally, we've completed the transition to removing growth promotion claims for shared class antibiotics. And again, we think this has to be a global action in going forward, where veterinarians, and also to move those to have veterinary oversight. We are convening industry leaders, and I'll talk more about the meeting we had about how do we increase veterinary training capacity, and then we're helping to look at data to get knowledge to help everyone make better decisions on use. As stated, we remove marketing or growth promotion for shared class, look forward for label changes, and again, we'll have those complete by 2017. The last ones are going through the process in Latin America. And in Taiwan, there wasn't an option to remain that market for a therapeutic claim because of the regulatory structure, and removed it from that market. As far as innovation, we came in the last year alternatives, a new vaccine, 2 new enzymes, some animal-only antibiotics. Inteprity is for necrotic enteritis in poultry, one of the main reasons we use shared class antibiotics. And Cavalt is an animal-only antibiotic for E. coli in baby pigs, another reason why we use shared class antibiotics. Protein, and again, my background, have spent time in R&D and bringing products to market, and there's really some cool innovation out there, but it takes time. Amrestor is a protein that stimulates and restores the immune system of dairy cows to protect them against mastitis. It's granulite stimulating factor. It's pegylated to have a long duration. By giving it to cows pre-calving, we reduce mastitis in cows by using their own immune system. Mastitis for dairy cows is one of the main use of shared class antibiotics. And again, the last year we committed 90% of our research budget for looking at those problems where shared class antibiotics are needed. Our goal was to have 10 candidates in a year. We only had 8 that met the goal, but we identified and looked at over 50, or I think we're close to 60 some now. 8 we thought was very encouraging that entered the development pipeline that's going to regulations and registration. We still have 21 remaining that will go through additional studies. So again, looking at our pipeline, we predict that we'll have 25 alternatives in the market by 2020. And we will have items looking forward to look at these disease challenges in a whole new way. Part of our outcome, we are working with Innovate to have a $2 million challenge to come up with new ideas, to look at those main concerns that's requiring share class antibiotic use. Liver abscess in cattle, necrotic enteritis in poultry and coccidia in poultry, and Lawsonia and strep suis in pigs. We have had a integrated data management, and we've extended our investment to have a Prevention 360 by doing analytics to understand, and then understanding how nutritional health is significant to impact the microbiome. We've set up a separate business. But more importantly, we were able to convene to issue this report at a meeting in D.C. about 2 weeks ago. And again, just having a report, we could issue that in a press release, and we didn't feel that we could have the most value by just talking about what we were doing, but have an opportunity to bring people together to continue that discussion and leave with action groups. So we're addressing the critical issue, and again, how do we come up with a solution that optimizes all three under the umbrella? So as we've looked at that, we were able to bring 60 of the CEOs of the top protein production companies globally that represented from 50 to 75% of protein produced in the world together to have a meeting. We utilized Jim Collins to kind of guide and direct how that was going forward, but also had another 200 people that were NGOs globally, regulators, and other influencers to try to drive to solutions. The outcomes, there was a commitment by the CEOs on 5 steps that was shared with the UN and the WHO of where we're proceeding on antibiotic stewardship and what we commit to, but then the formation of 5 different working groups but amongst that area to focus on veterinary capacity, how we have a model to supply veterinary services, what are the metrics of responsible use and what is responsible use, how do we have monitoring of resistance, and the 5th one is how do we move innovation along. And again, we were able to be there, but again, the force and the action is by the attendees. And again, like most of these meetings, what's the actionable items going forward? So as we look at that and this just more details about the incentive for innovation. Again, all we do is partner with many others that are more effective at applying the technology we can do. We see it as our responsibility to help and get the right people together and show leadership to demonstrate responsible use of antibiotics so we can maintain their effectiveness and still protect the health, welfare, food safety, and sustainability.